Tadalafil, best known by the brand name Cialis, is often called the weekend pill. But what really happens inside your body when you take it? Is it just about stronger erections, or are there hidden effects that most people don't know about? Here's a surprising fact. While millions of men use Tadalafil for erectile dysfunction, doctors also prescribe it for prostate problems and even lung conditions. That means its effects go far beyond the bedroom. In this video, we're going to explore exactly what Tadalafil does inside the body. Step by step, you'll discover the immediate changes it triggers in blood flow, the medium-term effects on your circulation and prostate, the most common side effects, and the hidden risks you must never ignore. And stay with me until the end, because I'll reveal the #1 effect of Tadalafil that can become deadly if combined with the wrong medication. So, what really happens when Tadalafil enters your system? Let's find out. Tadalafil is a medication that belongs to a class of drugs called PDE5 inhibitors. Most people know it by its brand name Cialis. Its primary purpose is to help men with erectile dysfunction, ED, but that's only part of the story. Doctors also prescribe Tadalafil for benign prostatic hyperplasia, BPH, an enlarged prostate that causes frequent or difficult urination, pulmonary arterial hypertension, PAH, dangerously high blood pressure in the lungs. One of Tadalafil's most unique features is its long duration of action. While other drugs like Viagra last only a few hours, Tadalafil can remain active for up to 36 hours. That's why it's nicknamed the weekend pill. But here's the key point. Tadalafil doesn't create desire or cause automatic erections. Instead, it helps the body respond more effectively when sexual stimulation is present. But how does this small pill actually influence blood flow and the body's natural response? That's exactly what we'll uncover in the next chapter. To understand Tadalafil's effect, we need to look at how erections naturally happen. When a man is sexually stimulated, the body releases nitric oxide, which triggers the production of cGMP. This chemical messenger relaxes the smooth muscles in blood vessel walls, allowing them to widen. The result? More blood flows into the penis, creating and maintaining an erection. Here's the problem. The body also produces an enzyme called PDE5, which breaks down cGMP too quickly. When this happens, blood flow slows and erections fade. This is where Tadalafil comes in. Tadalafil blocks PDE5, keeping cGMP active for longer. This means blood vessels stay relaxed, circulation improves, and erections are easier to achieve and maintain, but only with sexual stimulation present. What makes Tadalafil different is its long half-life. Once absorbed, it keeps PDE5 blocked for up to 36 hours. That's why men call it the weekend pill. But erections are only part of the story. Tadalafil also influences blood flow throughout the body, which explains its additional uses and benefits. In the next chapter, we'll explore the immediate effects that happen in the hours right after you take Tadalafil. Once you swallow Tadalafil, it begins to absorb into your bloodstream within about 30 to 60 minutes. During this initial period, several things start to happen. Blood vessel relaxation. Tadalafil begins to inhibit PDE5, allowing cGMP to stay active. This relaxes blood vessels, not just in the penis, but also in other parts of the body. Lower blood pressure. Because blood vessels widen, blood pressure can drop slightly. For healthy men, this is usually mild. For those on heart medications, it can be dangerous. Enhanced response to arousal. Tadalafil doesn't cause an erection by itself, but once sexual stimulation begins, blood flows more freely, leading to stronger and longer-lasting erections. Possible side effects. Within the first few hours, some men may feel flushing, a mild headache, nasal congestion, or indigestion, all caused by changes in blood circulation. Think of Tadalafil as creating a window of opportunity. During the first few hours, your body is more prepared to respond effectively when arousal occurs. But Tadalafil isn't just about immediate effects. Because it lasts so long, it also creates medium-term effects that influence the body over the next 1 to 2 days. That's exactly what we'll explore in the next chapter. Tadalafil is unique because it has a half-life of about 17 hours, which means it can remain active for up to 36 hours. This extended action creates several medium-term effects. Sustained erectile support. Unlike other ED drugs that fade after a few hours, Tadalafil keeps PDE5 blocked for much longer. This gives men greater flexibility. Sexual activity doesn't need to be rushed or timed so precisely. Improved urinary flow. By relaxing smooth muscles around the bladder and prostate, Tadalafil helps men with benign prostatic hyperplasia, BPH, urinate more easily, reducing frequent nighttime trips to the bathroom. Better circulation. With blood vessels relaxed throughout the body, Tadalafil can improve circulation efficiency, which is why it's also used in conditions like pulmonary arterial hypertension, PAH, confidence, and reduced anxiety. Knowing the effects last longer helps many men feel less pressure, which itself can improve performance and reduce performance anxiety. These medium-term effects show why Tadalafil is considered more versatile than other PDE5 inhibitors. But of course, with benefits come potential downsides. And next, we'll cover the common side effects that men often experience when using Tadalafil. Like all medications, Tadalafil comes with potential side effects. Most are mild and temporary, but they can still be bothersome. The most common ones include headaches, the #1 complaint caused by dilation of blood vessels, flushing, a sudden warm feeling or redness in the face, neck, or chest, nasal congestion, that stuffy nose sensation due to blood vessel relaxation, indigestion or heartburn because Tadalafil affects smooth muscles in the stomach as well, back and muscle pain. Unlike Viagra, Tadalafil is more likely to cause body aches, usually appearing 12-24 hours after use and resolving within 48 hours. While these side effects are usually not dangerous, they can reduce comfort and discourage men from continuing treatment. But there's another layer of risk, the serious, sometimes life-threatening side effects that must never be ignored. And that's exactly what we'll cover in the next chapter. While most men experience only mild side effects, Tadalafil can, in rare cases, trigger severe and dangerous reactions. These are the ones you must never ignore. Priapism, an erection lasting more than 4 hours. Far from being a sign of extra strength, this is a medical emergency that can permanently damage erectile tissue. Sudden vision changes. Tadalafil has been linked to a rare condition called NAION, non-arteritic anterior ischemic optic neuropathy, which can cause sudden vision loss. Hearing loss. Some men report sudden hearing loss or ringing in the ears after taking Tadalafil. While rare, it requires immediate medical attention. Chest pain, fainting, or severe dizziness. Because Tadalafil lowers blood pressure, it can interact with heart medications or alcohol, leading to dangerously low blood pressure and collapse. Allergic reactions. Swelling of the lips, tongue, or throat and difficulty breathing are rare but life-threatening warning signs. The most dangerous risk of all, mixing Tadalafil with nitrates or recreational poppers. This combination can drop blood pressure so fast that it can cause a fatal collapse. These risks make it clear, Tadalafil is powerful, but it's not for everyone. The key is knowing how to balance the benefits with safety. Next, we'll discuss exactly how to use Tadalafil wisely, so you can enjoy the positive effects while minimizing the risks. Tadalafil can be a life-changing medication, but only if used responsibly. Here are the key safety guidelines. Consult a doctor. First, never self-prescribe. A doctor will check your heart, blood pressure, and other medications to ensure Tadalafil is safe for you. Follow the prescribed dose. Daily doses are usually 2.5 to 5 mg, while on-demand doses can go up to 20 mg. Taking more doesn't mean better results. It only raises the risks. Plan the timing. Tadalafil works within 30 to 60 minutes, but because it lasts up to 36 hours, there's no need to rush or stress about timing. Limit alcohol. A small drink is fine, but heavy drinking can reduce effectiveness and dangerously lower blood pressure. Watch for warning signs. Mild headaches or flushing are normal, but chest pain, sudden vision or hearing loss, or erections lasting over 4 hours require immediate medical care. Stick to legitimate sources. Avoid counterfeit pills sold online or on the street. They may contain dangerous substances. Used properly, Tadalafil is not just safe. It can improve both confidence and quality of life. But let's bring it all together. In the final chapter, we'll answer the question once and for all. What is the true effect of Tadalafil on the body? So, what is the real effect of Tadalafil on the body? It's much more than just a pill for sexual performance. Tadalafil works by improving blood flow, helping men with erectile dysfunction respond better to stimulation. But its effects extend further, supporting prostate health, easing urinary symptoms, and even treating pulmonary hypertension. The positive effects: stronger, longer-lasting erections, improved urinary flow, better circulation, and restored confidence. The risks: headaches, flushing, back pain, and in rare cases, vision or hearing problems, chest pain, or prolonged erections that can be dangerous if ignored. The deadly mistake: combining Tadalafil with nitrates or recreational poppers, which can drop blood pressure so fast it leads to collapse or even death. The truth is this: Tadalafil is not magic, it's medicine. When used properly, it can change lives. When misused, it can put your health on the line. Now, I want to hear from you. Did you know Tadalafil had effects beyond sexual health? Which of these risks surprised you the most? Share your thoughts in the comments. I'll be reading them. And if you found this video helpful, don't forget to like, share, and subscribe for more science-based health insights. In the next video, we'll uncover another powerful connection between sexual health and your heart, a link most people never imagine. Stay safe, stay informed, and I'll see you in the next video.